Hey everybody, this is Jay Ellison of Echo Benefit Solutions, and I went and Zoom. I went and voted today, and I wanted to share with you some stuff that I researched that I did before voting that might help you make a decision, especially as it pertains to healthcare. So this right here is the Biden-Sanders Unity Task Force document. Okay, so this is the plan that they put together in order to secure Senator Sanders' support for Biden candidacy, Biden ticket. So it has notable committee members such as former Senator, former Secretary of State John Kerry, and the lovely and ever informative Representative Alexandria Ocasio-Cortez of New York, one of my personal favorites in Congress. And so it's on combating the climate crisis and pursuing environmental justice. But you get down into page 28 of this, and they get to healthcare, which somehow is related to environmental justice. Go figure. So, and forgive me for reading some notes here because I want to make sure I say this exactly right. So, page 28 says, achieving universal, affordable, quality healthcare. Universal. It talks about people with pre-existing conditions. In the paper, it says there's over 100 million Americans with pre-existing conditions. The Center for Medicare Studies says less than 50% of that. And a lot of industry groups, the consensus seems to be somewhere around 50 million. Yet, no more than 20 million have ever enrolled for pre-existing coverage. And you can define anything as pre-existing. Your life's a pre-existing condition. Nobody gets out alive. So you can frame the numbers however you want to get the objective you want if you define pre-existing as being alive. It also uses the COVID-19 situation in order to, really expand federal control of everything from day-to-day healthcare to how it's funded, to how supplies are done, to medications and everything, and just really wrestles control away from the private sector for everything under the federal government. And nobody thinks our system is perfect. I got it. I mean, I'm in the federal system and I'm in the private system, and none of it's perfect. It is maddening. But do you really think the federal government is qualified to run it all? And where do people around the world who can afford to go wherever they want for healthcare, where do they go? They come here. They ain't coming to the VA. Been to the VA? Go look in the waiting room there. Do you know how long it took me to get an eye appointment? Get my eyes checked? 6 months. 6 months. That's what you're signing up for your kid's pediatrician with federally run healthcare. Okay. So the plan doesn't immediately transition us from private to federally run. They've got this great plan to help to compete, have the private insurance companies compete with the federal government. How the hell do you compete with somebody that can print money? Print your own money. Okay? So it's all competition and incentives, which the public sector knows nothing about. Okay, so here's things in order that they mentioned in the plan. So they want the federal government to cover 100% of COBRA costs for everyone. That's 36 months of free coverage for you when your employer coverage runs out. And I'm sure that sounds great. Who's paying for that? Your neighbor, your kids, your grandkids. Okay, they want year-round marketplace enrollment. I'm not totally opposed to that, but when you can't ask any questions when somebody joins, what's to keep people from waiting until they're sick then to join? Okay, it's not insurance anymore. Now you're paying for stuff that's already happened. Automatic enrollment for low-income Americans in zero premium platinum plans. That's really hard to say. Yeah, that's not going to be crazy expensive. And then on the public option side, they want there will be a zero deductible plan available for all Americans, even if they have employer coverage. So zero deductible, low-cost plan. Have you priced zero deductible plans lately? Ain't nothing low cost about that. You're picking up a tab for that. Okay? So the effect this will have is that all employers are going to dump their coverage. Why would they pay for benefits for their employees. Benefits those employees overwhelmingly like in health. Why would they continue to spend that money? They're going to get hammered on taxes, and free stuff is out there that they don't have to pay for. So bye-bye employer benefits right there. That's not evil corporations. That's just cause and effect, dollars and cents kinds of decisions. Why am I going to spend thousands of dollars a month when my workforce can go get it for free? Okay. All right. So then low-income Americans will be able to roll in Medicare at age 60, even though our life expectancy is getting longer every year, and the length of time people are working is increasing. So we're going to backtrack and bring it down to 60 into a system that's already not funded enough for the people that are aging into it day by day. Hello, boomers. Makes a lot of sense. Okay, and then when it comes to prescriptions, okay, we've seen a lot of improvement in prescriptions in the last year or so, especially with regards to insulin. This takes that and just puts the heavy hand of government right all over it. Eliminates like regulations on capping drug costs, decreasing patent length, and price controls. Right? So what the effect that has is if you decrease the patent length, make it impossible for companies to recoup their R&D and marketing costs. And the R&D costs are almost entirely based on the insane FDA requirements that they have to meet in order to bring a drug to market. Never mind the fact that there's trial lawyers just waiting to sue them for anything that goes wrong. But we still have this insane, 10-year process to bring a drug to market. And that cost gets passed directly to you, okay? So if you decrease the patent length on that, where's the incentive to bring every possible new advance to market if they can't recover those costs? Okay, and then, price controls. Price controls have never worked. If you look at things like rent control and price controls that have happened during the FDR era, they don't work. Find ways around it. It creates black markets. It creates these gray areas of new categories of things, and people will find ways around it. And the people that get left holding the bag are usually the people who are too busy to research the workarounds, and people that don't have the money to take advantage of the workarounds. So all of this government control that's supposed to help the little guy is going to end up screwing the little guy who's going to wait longer for worse care, pay higher taxes, be wildly dissatisfied with the coverage he has, and for their kids. And politicians are still going to get theirs. They're still going to have their carve-outs. They're still going to be immune from this. They opted themselves out of the Affordable Care Act too, right? So none of this will apply to them. This is all a way just to tell you who to go to see, where to get your health care, control your decisions by people in DC who don't care about you. And I don't think the insurance companies care about you either. Don't get me wrong, but you can take your business elsewhere. Where do you go when the government runs everything? So try not to make a recommendation to vote for it. But when you listen to people talk, there's a party that tells you the government can do everything for you and make it cheaper, faster, better than the private sector. And there's a party that tells you that you have the right to live your own life. Make your own decision. So Jay Ellison, Echo Benefit Solutions, out and vote because your health depends on it.